and thought, what have you done with that? How did you do it? But you've told me, so I've got the number. But you work within the NHS, so what do you do in the NHS? What kind of a doctor are you? Because I know it's a broad brush, isn't it?
Absolutely. So I'm a doctor that works in critical care and anaesthetics. I also work in the emergency room. Over the last 10 years, I've worked as a healthcare assistant in nursing and a physician associate as well. So I've done a broad range of different roles. And I can say that from the start right down to now, it's the staffing. I don't think nurses are taken care of well enough, and also doctors too, but particularly the nurses. There's not enough nurses. Nurses are dissatisfied, and we don't have enough people taking care of the people that need taken care of. And COVID's just made that worse. But that's what's happened. COVID took us by surprise, and we're dealing with it. We need more people to deal with it, and they need to be treated better.
Do you think it's highlighted the inadequacies? And in your time there, because you said you've been in it for a while, have you noticed, because for me, I see the managers, there's so many of them, has that increased? And in your view, is that a bit of a problem now? Or?
So I think it's a controversial one, because we often talk about the managers and the people in the middle, and are those people medically trained? You know, should there be clinical staff in those positions? And that's where I think we should be focusing. Those people should have experience being on the front line, you know, dealing with patients and understanding, you know, what the problems are. And of course, you know, we often like to talk about those people are being paid a little bit too much when we're on the front line, and not only do we have the experience, but, you know, we understand what it means technically to, you know, have patients flow through the system, go and come. You know, if you talk to junior doctors, you know, they're doing their discharge summaries, and you talk to consultants, you know, they're having a headache because, you know, they can't get new patients in. There's bed blocking. So those positions need to be filled with the right people.
Yeah, so because a lot of people would say that's one of their biggest challenges, because the money doesn't seem to be going to the right place. There's a lot of money in it, so it's not like it doesn't have a lot of money. If you could rework it, what would you do to make it better?
Thank you for that question.
Good luck.
I think it always goes down to the patient care. And you talked about the NHS being a business. Really, unfortunately, it's not, because if I see 100 patients a day versus 10 patients, I'm not going to be rewarded for that. It's a social system for the people. Some people are going to use it a lot more than other people. So therefore, you know, that guides my way of thinking about how it should be better. I think the staff should be taken care of better. The nurses should want to be nurses. You know, there should be a fight to become a nurse. There should be, you know, of course, there's a fight to become a doctor, because that's, you know, that's a long-standing thing. But the nurses are the ones, they, you know, are day to day with the patients, and they have a unique role in getting the patients through and making sure the care is adequate. And that's what we're missing.
What about bringing back matron?
Matron?
Yeah, because when I was younger, and I am old, I know, I don't look it. You didn't say it, but I can read your eyes.
You look great.
Thank you, thank you. It's a bit late, it's a bit delayed, but we'll let you have that. So, yeah, but bring back matron, because that was, when my mum she was a midwife as well, and she said that when it was that way, and these, as you said, the people managing the thing were actually on the front line with their hands actually getting dirty. Do you think things like that would be better?
Absolutely, absolutely. I mean, that's just one example, but that way of thinking, you know, focusing on the people, that way of thinking is where we need to go.
Yeah, well, let's hope that this time when they take the 12 billion off us out of our national insurance rise, that they start thinking outside the box. It's good that